A very common question which patients do ask to us and do write in the comment sections in our previous videos on YouTube is, if we stop taking minoxidil, our hair fall is going to increase. So we are going to talk about how and when to stop minoxidil if you are using it for your hair loss problem. I am Dr. Satya Saraswat, a gold medalist plastic and cosmetic surgeon, a member of ISHRS and ABHRS and various other national as well as international organizations, and in this field of hair loss treatments and hair transplants since 2006. That means we have entered 19th year of our hair transplant practice. So please keep watching this video till the end, because we are going to share a lot of pearls of wisdom with you, with all our viewers out there, so that they have much more clarity about these aspects of minoxidil which are often discussed about, that if we stop it, it's going to reverse, it's going to increase, and all those kinds of myths. Also, do subscribe to our YouTube channel if you want to gain authentic information about hair loss and hair transplant. As we have discussed in one of our previous videos on minoxidil, the way minoxidil actually improves the hair loss problem is that the most important thing it does is that it changes the permeability of the potassium ion, thereby causing vasodilatation, which means that the blood vessel, they will increase in size. The blood flow will increase to the area where you are applying minoxidil. That means when you are applying it on the scalp, it will improve the blood flow of that particular area, and if you are applying on a beard also, then also it will increase the blood supply to that area. What this increased blood supply means, that it is going to provide more nourishment, more nutrition, more micronutrients, more oxygen to that area. With these, there is decreased free radicals and inflammatory changes are reduced. A lot of growth factors are also released into that area, and minoxidil has been in use for more than 35 years now for the hair loss problem. So we all know that it is one of the very important tool in fighting your hair loss problem. There are two medicines currently which are US FDA approved. One of them is minoxidil, then the other one is finasteride. So if you have a genetic tendency, if you have started losing your hairs just recently or even for a long time, your grade of baldness is increasing, the Norwood grade is increasing from grade 1, 2, 3 and going forwards, there are 7 grades of baldness as we all know. If you have that kind of problem, then one of the most important medicine which your doctor can prescribe it to you is minoxidil. So these are the ways in which it helps. Now coming to the question that the hair fall, till when should we take minoxidil, and if we stop it, then our hair fall increases. So first of all, before actually starting your medical treatment, you have to carefully consider that all the medicines, either they are consumed as a tablet form or they are applied as a lotion form or ointment form, anyway, they have a limited action, duration of action on that part of the body, whether you are eating or applying it. So to think that there is a short course for these medicines is probably not right. You have to commit yourself to a long-term treatment, because it's just like taking your food. If you do not take food, if you are fasting for even a couple of days, your body is going to, it's going to become weak. Similarly, if you're not providing good oxygen and nourishment to the hairs, they are going to shrink and shrivel, and the hair fall can again increase when you stop minoxidil. When you should stop taking minoxidil? So obvious answer is, if it is not giving you the desired result, even if you have applied it for a duration of 4 to 6 months, because minoxidil is effective in around 80% of the cases. There are people, if they have a deficiency of a particular enzyme known as sulfotransferase, which converts minoxidil to its active metabolite minoxidil sulfate. If there is lack of that particular enzyme, that it is not going to work out for you, then obviously you need to stop minoxidil. If your hair loss concern has stopped bothering you, like if you got married and then you're approaching your 50s or even later on, when you think that it's no more worrying thing for you, then you can stop applying minoxidil. And the most important factor is, if you're having any side effects to minoxidil, the common side effects as we know are irritation, itching, redness, sometimes throbbing pain or throbbing headache, pain in the head, or if you are getting excessive hair growth, especially in females, which is known as hypertrichosis. So these are some of the common conditions where you may need to stop taking minoxidil. Also, if you feel that compliance is a bit bothersome for you and you're not able to comply with minoxidil, you're skipping them irregularly without actually making minoxidil a part of your daily hair care routine. In those conditions, you may need to stop minoxidil. I would request you to like this video if you're liking the content till now. If you have faced any of the side effects of minoxidil, or if it has not worked out for you, as is possible in some of the cases, I would request you to write down into the comment section below. If you want to know more in detail about minoxidil, how it works and the kind of side effect it can have and how to prevent these side effects, you can watch the video given in the link above. Now coming to the most important point or part of this video, how to stop minoxidil. So if you are having a male pattern genetic baldness, male pattern baldness, also known as androgenetic alopecia, and you are on minoxidil as well as finasteride, then my first request would be not to stop both the medicines immediately at the same time. You should always have some medicine working out for you. Otherwise, you will have a rapid hair fall again coming back if you stop both of the medicines. Now, how to stop it? If you are applying minoxidil lotion, the actual dose is 1 ml twice a day using a dropper or a spray. So, for a period of 2 to 3 months, start using minoxidil daily rather than going from twice a day. Try to use it once a day and then see if your hair loss is still stabilized or not, and keep on taking the other medicine, that is finasteride or dutasteride, if the doctor has prescribed it to you. Then after a period of 2 to 3 months or 4 months, when you have tapered down from twice a day to once a day, start applying minoxidil for another 2 to 3 months alternate day. That means once a day, applying minoxidil once a day on the alternate days. Keep on doing this for 2 to 4 months, and then again try to assess objectively if your hair fall has increased or is it remaining same. Then go to from alternate day, go to twice a week, and then slowly taper it off. So the tapering should not be sudden, it should be gradual, and slowly you have to taper the dose of the minoxidil over a period of 6 to 9 months slowly. As per this slowdown, stopping or reducing or tapering the dose of minoxidil, you can titrate as per your hair loss condition. You can always take a guided plan from your treating doctor about how to stop minoxidil. But again, the most important thing is that do not stop both minoxidil and finasteride at the same time. Keep on taking other medicine rather than stopping both of them. If you are planning a hair loss treatment or looking out for hair transplant, then you can call us at the numbers mentioned here on the screen if you want to take these treatments from us. Now coming to another important part is when to stop minoxidil after hair transplant. So ideally, till the full growth has happened, which happens after 12 to 15 months after the hair transplant, you can reduce the dose from twice a day to once a day, but it is not recommended that you altogether completely stop applying minoxidil, because in that case there have been studies which have shown that if you are not taking minoxidil or even finasteride after the hair transplant over a longer duration, your transplanted hairs can thin down and the density can appear to be less if you are not using it. So after full growth of 12 to 15 months duration, taper it down to once a day, and that's the dose you should be using as a maintenance dose. Friends, you know that it just takes you 1 minute to apply minoxidil. Unless you have some side effects, please incorporate minoxidil into your daily hair care routine. Just like we apply deodorants, perfumes, we wash our face, we apply sunscreen, and there are a lot of other things which we do for our body, skin and hair. Similarly, try to use minoxidil as a maintenance treatment for your hair loss problem. If you find this video useful, then please do share this video with your friends, family members, or your colleagues who are looking out to have more information on how and when to stop minoxidil. If you want to see one of our hair transplant patients and the results of our hair transplant, you can click the video on the left, and if you want to know home care remedy for your hair loss, you can click the video on the right.